What medications interact with loop diuretics? Have you ever wondered how loop diuretics work and what other medications might affect their performance? Loop diuretics, such as furosemide, torsemide, and ethacrynic acid, are commonly prescribed to manage hypertension. They help the kidneys remove excess sodium and water, which reduces blood volume and lowers blood pressure. However, these medications can interact with several other drugs, leading to potential complications. One major interaction involves lithium. Loop diuretics can increase sodium excretion, which lowers sodium levels in the blood. Since lithium clearance depends on sodium levels, this can lead to lithium accumulation, raising the risk of toxicity. Symptoms of lithium toxicity include confusion, muscle weakness, and blurred vision. Therefore, if you are taking lithium, your healthcare provider will likely monitor your levels closely or may suggest avoiding this combination. Nonsteroidal anti-inflammatory drugs, commonly known as NSAIDs, such as aspirin and ibuprofen, can also interact with loop diuretics. These medications may reduce the effectiveness of loop diuretics by decreasing kidney blood flow and sodium excretion. This interaction can lessen the blood pressure lowering effects that loop diuretics provide. Aminoglycoside antibiotics are another group to be cautious with. When used alongside loop diuretics, especially ethacrynic acid, there is a heightened risk of hearing loss. This condition, known as ototoxicity, can occur due to the combined effects of these medications. If you are taking other diuretics, combining them with loop diuretics can increase the risk of side effects. This includes electrolyte imbalances and ototoxicity. For instance, using ethacrynic acid and furosemide together is not recommended. Potassium-sparing diuretics and potassium supplements also requiring careful consideration. Since loop diuretics can cause potassium loss, combining them with potassium-sparing diuretics or supplements may lead to excessive potassium loss, or, if potassium-sparing diuretics are used alone, the risk of high potassium levels. Monitoring is essential in these cases. Another medication to be aware of is sucralfate. This drug can interfere with the absorption of loop diuretics when taken together. Sucralfate coats the stomach lining, which can hinder the effectiveness of oral medications. It is best to take these at different times. Loop diuretics may also interact with various other medications, including certain blood pressure medications like angiotensin-converting enzyme inhibitors and beta blockers, diabetes medications, and drugs that affect electrolyte balance. These interactions can alter drug levels or increase side effects such as low blood pressure, dehydration, or electrolyte disturbances. In managing hypertension, being aware of these interactions is vital for the safe and effective use of loop diuretics. Healthcare providers often monitor electrolyte levels and kidney function during treatment, adjusting medications as necessary to avoid complications. It is essential to inform your healthcare provider about all medications you are taking, including over-the-counter drugs and supplements, to prevent harmful interactions.